A lot of the changes that we see later in life, and this is important to understand, are related to how we cared for our skin when we were younger. For example, we might see more lines appear on our forehead and our skin is becoming more lax or more loose. That is related to collagen that started to break down in our 20s. I really want to emphasize for you the importance of a good foundational preventative skincare routine. Hi, I'm Dr. Caroline Robinson, board-certified cosmetic dermatologist in Chicago, and today I'm giving you the tea on cosmetic treatments that are actually worth your time and money. If that sounds like a plan, stick around. Cosmetic dermatology is about helping people become the best versions of themselves and present that to the world accurately. When I first started in aesthetic medicine, I noticed something really interesting. I think that there's a misconception that cosmetic dermatology, cosmetic medicine is all about just making beautiful people more beautiful. And that's not the case. What I actually noticed is patients were complaining to me that at work or even at home, their friends and their coworkers were telling them that they looked tired when they weren't, or telling them they looked angry or upset when they weren't. How I approach cosmetic medicine is that it's about matching that image that you have in your head to what is actually being presented to the world. A lot of the changes that we see later in life, and this is important to understand, are related to how we cared for our skin when we were younger. For example, we might see more lines appear on our forehead and our skin is becoming more lax or more loose. That is related to collagen that started to break down in our 20s. I really want to emphasize for you the importance of a good foundational preventative skincare routine. We're going to walk through some of the most impactful cosmetic treatments, but understand that this is a roadmap. You do not have to do everything on this list, and everything is structured and organized by level of intensity, level of aggressiveness, level of invasiveness. I like the analogy of maintenance before repair. If you're like a car person or a house person, you understand that there are strategic steps that you can take to prevent some of the long-term damage that can be done to your car or to your house. In this case, there are preventative steps that you can take. There are quote unquote anti-aging. I really don't like that word, but you know what I mean. Steps that you can take so that you can avoid having to do more drastic treatments like a facelift, for example, down the road. Okay, so let's walk through this roadmap together. Foundational treatments. Sunscreen, sunscreen, sunscreen. You've heard me say it before. It is the single most important step you can take to prevent that repair that you would need to do later in life. In this case, what matters more is consistency. You do not need a $100 product. You just need the behavior of wearing sunscreen every single day. SPF 30 plus, make sure it's broad spectrum, and you're good to go. If you want to learn more about sunscreen, you can actually check out my other video all about this topic. Next is retinoids and retinol. Retinoids and retinol, an important ingredient. Remember how we talked about maintenance? Most of what we see as we age on our skin is related to collagen loss that starts in our 20s. The most effective skincare ingredient to help you boost, to help you maintain your collagen is topical retinoids. The best options are prescription strength. Tretinoin and adapalene is an over-the-counter version of a retinoid that is also available. Antioxidants. Antioxidants are super important because they do a couple of things. They help to repair some of that sun damage, like just that little bit that we get every day from doing regular tasks like going and checking the mail. This is again one of those categories where consistency is going to matter more than anything. One antioxidant that I love in particular is topical vitamin C. It's a cofactor for collagen synthesis, so it's actually supporting some of that retinoid functionality that we talked about earlier, and it helps to even skin tone by directly impacting an enzyme responsible for excess pigment. Topical vitamin C is a top choice for me in your foundational routine. Not all vitamin C's are created the same. I recommend topical THD to my patients, and this is part of our foundational routine here at my office. So to summarize, consistent sunscreen, consistent SPF, a retinoid, and antioxidants, those are the foundation of your preventative aging routine. That might sound boring, but it is actually all you need. Every year, probably like 4 times a year, some new skincare product comes out and is claiming to be the holy grail of holy grails. And if you stick to this core routine, you will not be swayed by trends. You will continue with your prevention and putting off your repair, and you'll just be a happy camper. So just do it. As we get into some cosmetic procedures, the first category is skin quality. And I list this first for a reason. We talked about this roadmap of going from less invasive to more invasive, but it's also the concept that your skin and the quality of your skin determines how you age. That should be priority number one. With your foundational routine, you should already be in a great position to enter into some of these treatments. So let's get into it. First, my number one recommendation is medical grade microneedling. Now, this is different from at-home microneedling, which generally I do not recommend. In-office microneedling is able to achieve a depth that is deep enough to stimulate collagen, and it also helps with other things, acne scarring, fine lines, improving pigment. It does this by creating controlled injury of the skin that stimulates our healing process and can boost collagen by up to 400%. Something interesting, this is an interesting conversation I've had with some of my patients, is that a lot of cosmetic treatments have the goal of injuring the skin. You're like, what? Why? Why are we doing that? Well, in order to get all of that goodness, all of that repair that is at a level, maintenance level, if you will, like not the big repair, the little repair, in order to do that, you have to injure the skin somehow. And that is essentially what microneedling does. It creates a little tiny section of injury next to normal skin. That allows you to heal without the downtime, and it allows you all of those benefits of the healing process. There is also RF microneedling or radio frequency microneedling. Personally, I do not do this in my office. It combines radio frequency technology, which is heat, with microneedling, which is that little, controlled injury. I personally find that it's, one, not necessary for my patients, and two, can create a little more harm than good. So I avoid it. Chemical peels. I love this, especially if you're early in your rejuvenation journey and you are trying to tackle some specific skin concern. For example, acne, great for that. And any kind of condition that is producing a lot of pigment, like melasma, for example. I like chemical peels almost like a reset to get you more balanced with your skin before entering other cosmetic treatments. Chemical peels range in depth, and that's kind of determines their treatment outcomes. For example, you have more superficial peels. We used to call them lunchtime peels, just give you a little bit of brightness, a little bit of improvement in your texture. And there are medium depth peels like a TCA and even deeper ones. I use a lot of superficial to medium depth peels here in my office just as an adjunct, not as the main anti-aging treatment. If you are not dealing with a skin condition that needs immediate attention like acne, and you're really just more looking for something that is a maintenance treatment, I would opt for microneedling over a chemical peel. Then let's talk about laser. Laser is another skin quality treatment that I love. This works very similarly to microneedling. I like to tell my patients that microneedling is like laser without the light, and laser is like laser, obviously, with the light. And it is creating little columns of skin injury normal skin next to injured skin, next to normal skin, and helping you heal faster. That's how non-ablative lasers work, for example. There are also ablative lasers that remove the whole layer of skin. Those have a lot of more downtime, but for the right patient, those can be a great option for some faster improvement and faster results. Now on to one of my favorites, which is skin boosters. This is a category of skin quality treatments that I don't think a lot of people are aware of. It's a lot more popular overseas. It's actually the second most popular cosmetic treatment after Botox. And in the US, we were recently introduced to the category of skin boosters. Skin boosters are really interesting because they literally do what they say. They boost your skin quality. Usually they're a very dilute hyaluronic acid coupled with another ingredient that helps with the integrity of the skin. They're injected like little micro droplets into the skin, and you usually get results like more hydration, less wrinkles, less fine lines, and it's sustained, usually lasting about 6 to 12 months. I actually use this a lot with my patients who have microneedling, just as a finishing touch to help with any fine lines that weren't corrected from the treatment. Most of these skin quality treatments are low downtime, which is great. They have lasting results because we're not doing things like my approach is, yes, I want the skin to look good, but I also want to help make the skin better in a sustained way. But skin quality category has a lot of treatment options in there. Most of them are low downtime, which is great. Microneedling, for example, 3 to 5 days of redness. Laser, very similar. Chemical peels, depending on the strength, 7 to 10 days of some dryness and flakiness. But the biggest thing is that this category as a whole helps to improve how your skin functions, how your skin looks, and it does it in a scientific way that is long lasting. Next is injectables. Botox is a tool. It is a tool to help slow down the communication between a muscle and a nerve. So we have all of these muscles of facial expression. They help us raise our eyebrows. They help us frown. They help us smile. And all of those muscles, in doing that, they have to pull on the skin to do that. What Botox does is it helps tell that nerve to just chill out a little bit. Can we just not like as much pull on the skin? And therefore it smooths some of those expressions. The goal of Botox is to have smoother expressions, not frozen expressions. I always have to tell people that. If they want that kind of frozen look, it's not on the menu at my office. I do regular Botox treatments myself, and many of my patients do. So if you're interested in learning more about Botox, let me know in the comments. We can do a whole episode on that. Fillers are another tool, which I love. They are typically hyaluronic acid, although there are other types of fillers that are biostimulatory. They have ingredients like PLLA. What they do is help restore volume that is lost. There's a little trick that you can do to kind of figure out if you're a candidate for filler. I call it the sink or sag test. Both sinking and sagging are indications, in my opinion, for filler treatment. And sinking is when you kind of feel along your cheek if you feel like your cheek is kind of like recessing or sinking back, that means that you have likely lost volume in the middle of your face. That is one of the first places where I notice volume loss in my patients, and restoring that area can help to restore some of the things that they're noticing, like hollowness under the eyes or smile lines. Another change that you might notice is sagging, when you feel like your cheek is literally sliding down your face. That tends to occur in older individuals, and that is also an indication for filler, but you might be a candidate for some other treatments as well. I think the thing that we are noticing about filler lately is that some of it's overdone, and a little bit of filler goes a long way. So if you're watching this, your team less is more. Err on the side of less. Make sure that you are Getting a consultation and discussing your goals with your provider so that you are on the same page about the look you want. It's about restoration, it's about maintenance, it's not about augmentation or changing who you are. The reason that we're losing volume is because we aren't just aging in our skin, we are aging in like 4 dimensions. Our skin, just the top layer, that deeper layer of skin called the dermis, that's where our collagen, our elastin is, and all the scaffolding that holds our skin together. Beneath that, we are aging in our fats. We are losing facial fat and we're gaining it other places. I know it's not great, it's not fun, but it's the reality. And we are also aging in our bones. So we get bone loss, especially in our mandible with our dentition, and that creates some sinking and sagging itself. So you understand that we're aging in 4 dimensions. I like to say that there is a 5th dimension that we are aging in, and that is with our lifestyle, because depending on your lifestyle, you can age faster or slower. And lifestyle is everything from what you eat, your diet, from stress, which literally releases cortisol that makes you age faster. Make sure that when you approach cosmetic treatments and even your skincare routine, that you're not ignoring that 5th dimension of how you're aging. There are multiple ways to restore volume. Fat, using literally fat from somewhere else on you and placing it in your face, is a very commonly, it's becoming more common, performed treatment, and that is a great option alternative to filler. One approach to this injectable section is to look at it by decades. For my 25-year-olds, because I generally don't start any injectable treatments on patients younger than 25, but for my 25 to 30-year-olds, we're talking more about neuromodulators like Botox. For my 30-year-olds, we're talking about, are you noticing volume loss in certain areas? And should we be considering some small amounts of filler or filler alternatives? And then for my 40-year-olds, we should be considering some restoration of volume, whether it's filler or a filler alternative, and we're having more serious conversations. So that's kind of like the roadmap within a roadmap of this section. Energy-based treatments. I don't think we talk about these enough. There is a whole category of treatments that also help with some subtle skin tightening and some subtle lifting that are the next step of our roadmap. These include things like radiofrequency and ultrasound. These usually work by heat or ultrasound technology that is communicating with that collagen and telling it, hey, you need to make more. And when you make more, we need it to be tighter. I do a ton of radiofrequency and ultrasound in my office. I think it is a great treatment for helping to give some subtle tightening, some subtle lifting. And it does this because it's able to reach that SMAS layer. It's this layer beneath the skin that helps to hold everything in place. Another energy-based treatment that deserves mention in this section is LED, the most popular of which is red light masks, red light LED. We even have in office. These treatments are great, but not for what you might think. One of the uses that I found them most effective for is just helping the skin to recover. If it's not become clear to you, cosmetic science, cosmetic dermatology is the same exact science as wound healing. We really need things in our routine that are helping to repair and calm the skin. Your foundational skincare, of course, is going to do some of that, but red LED is a nice to have, not a must have, nice to have adjunct to help with skin repair. Let's move on to surgery. Say that we've done all of the steps on the roadmap and we are just not seeing the results, or maybe it was too little too late. That's the rare instance when I think surgery becomes an option. Also, I will just say that sometimes genetics isn't our friend either, and life has just taken its toll. Surgery becomes an option. And so a few of the commonly performed surgeries are facelifts, of which there are varying types. Blepharoplasty, which just involves removing some of the skin around the eye area, and a lower face lipo, just to get that little bit of fat that can sometimes accumulate there as we age. To recap, we want to be strategic with our cosmetic treatments. We want to do things that are worth our time, that are worth our money, and following this roadmap will guide you to the next step. Laying the foundation with a strong skincare routine that is evidence-based, sunscreen, retinoids, and topical antioxidants is going to take you a long way. Focusing on skin quality is something that I emphasize because how your skin ages is how you age. And not neglecting those deeper layers, whether you become a candidate for neuromodulators, filler, some filler alternatives, or energy-based treatments, the goal is a less is more philosophy because the less you do to your face, actually, the more like you will look. If you're lost on the roadmap, let's get back to, is it worth your time and is it worth your money? Skincare, definitely worth your time. Skin quality treatments, you do not need to do them all. Just find the one that is working best for you for the goal of building and boosting that collagen in your skin to help you age better. Injectables, less is definitely more, and you want to be strategic and natural looking with what you're choosing to do. LED, energy-based treatments, these are all nice to have, but ultimately those earlier roadmap steps are going to carry you most of the way. So hopefully you've watched this, you've learned something, and you've figured out, is it worth your time and money to do some of these popular cosmetic treatments? If you love having conversations like this, don't forget to like and subscribe, and let's keep the conversation going. See you next time.